weather forecast. For today, partly sunny and breezy, a passing shower or two with a high 53. Tonight, cloudy, chilly, low 43. You'll see a shower in spots to start Saturday, otherwise clouds and sunshine, a high 58 and a low 42. Mainly cloudy on Sunday with a high 62, and sun and clouds Monday with a high 65. I'm Andy Robb for News Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay. Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our guests are Renee Meyer and Molly France with Mental Health Intensive Outpatient Program of Aultman Hospital. Good morning and welcome to the show.
Good morning.
Good morning.
We'd like to remind our listeners our program today will also be available on our podcast. You can look for that in your favorite podcast app by searching for Health Matters with the Medicine Center Pharmacy. Please subscribe to our program, and we hope you enjoy today's show.
So, Renee Meyer is a licensed professional clinical counselor. Tell us about yourself and your position.
Okay, so I am part of the Aultman Hospital's intensive outpatient program, and I'm a licensed professional clinical counselor, and I've been here for quite a few years. And prior to this, I worked on the inpatient unit when Aultman Hospital had their inpatient unit. And I've done case management, and I've had supervisory position doing that. But I've been here for quite a while now, and I think this is probably the best position that I could have. I really like what we do.
Okay. Molly France is a licensed professional counselor. Tell us about yourself and your position with the outpatient program.
Yes, so I am a licensed professional counselor as well as a licensed professional art therapist. And I have had many years of experience working both with adults and children in the mental health field. I've had community-based mental health, private practice, hospital-based, as well as many different experiences through art therapy. And I would agree with Renee that this position by far in the intensive outpatient program has been one of my favorites, but also the most rewarding, and really has tapped into our strengths for the two of us combined to create this incredible program for our community.
Okay.
All right. Well, Molly, what is IOP, or the Intensive Outpatient Program?
Right. So IOP, as abbreviated, or the Intensive Outpatient Program, this is a level of care considered a higher level of care. Typically in the field of counseling or mental health, one may see an individual counselor, that is one level. And sometimes, though, when symptoms worsen or get to a level where they might need more than an individual counselor, they can be referred to IOP. This is that level of care that's right before inpatient, but it also can be a step down for anybody who's coming out of inpatient as well. It's where folks can come in and receive counseling on a more intensive level that might need a little bit more than what they might be getting from one-on-one counseling.
Interesting.
So May is Mental Health Awareness Month. What do you think is important to remind the listeners today about taking care of their mental health?
You want this one?
Sure. I don't think we think about our mental health all that much until it gets problematic, till it starts disrupting our lives. And it's really important to take care of our mental health every day, and not wait until it does become problematic or severe, which is what Molly was talking about. You know, that's when our our program comes into play. But taking care of one's mental health can be something so simple as having alone time, having some quiet time, knowing where your limits are at work, being able to talk to yourself about what your limits are, being able to ask for help, um, even if it's just on an everyday basis, being able to say no, or not right now, but taking care of one's hygiene, is, that can be considered personal time and also self-care. And that's one of the things that people, when things start getting really stressful, we start taking shortcuts and cutting things out that are really absolutely helpful. So just every day, ask yourself, how would I like to feel today? And how can I help myself to get there?
Mhm.
How does a person know if they need more than a counselor?
So, as I mentioned earlier in a little bit more detail about what IOP is all about, anytime that your symptoms, as Renee was starting to talk about, when we start to notice things are becoming problematic, or our symptoms are starting to impact our functioning, or our day-to-day lives, so to say, how we want to live. And sometimes we need more than an individual counselor, more than that once a week or once every other week. And if you start to notice that I'm needing to call and ask my counselor, hey, can you squeeze me in another session this week? Or if your relationships, you might be calling off work, or you might be leaving work early due to having a hard time regulating or having a hard time managing emotions while at work.
Concentration
And focus are really in a decline. Typically, these are all signs and symptoms that you need a higher level of care typically than what you may be getting. It's not at a fault to the care you're currently receiving. It just means that you might need more than what you currently have. And sometimes that means IOP, coming in every day, being able to have another set of eyes and ears on what's going on, and be able to work through those symptoms and be able to regulate self more consistently.
Mm-hmm. Oftentimes there's a focus on the problem,
Mm-hmm.
and which just sort of raises emotions, and then we stop being able to think clearly, and we're not able to work on solution focused. And so that's one of the things that we find people are struggling with before they come in.
Mm-hmm.
So, can you tell us about your intensive outpatient program at Aultman Hospital?
Mm-hmm.
Okay.
So, Aultman's IOP, Intensive Outpatient Program, the reason why it's called intensive is because we run Monday through Friday. We start at 8:30 in the morning, and we get them out right at 12. But Monday through Friday, and because of that intensity level, the program is really only on the average of about 12 or 13 days. But again, that's because we have them every day, and we focus on alleviation of symptoms, and symptoms we consider thoughts, emotions, behaviors. And while they're in the program, we're very skills based, so we have very applicable skills. That what we tell people is that the skills don't keep life from happening, but they help us maneuver through what's happening in a more purposeful, confident way. And because as adults, we have a lot of things that happen, and it would be nice if one thing happened at a time, but it doesn't. And so sometimes it can get to the point it's like, what am I supposed to do with all of this? But while they're in the program too, they would see our psychiatrist, and which, as I think Molly said earlier, it's another set of eyes and ears on their symptoms. Not everybody's on medication when they come in, but it is nice to have, a psychiatrist, which is a medical doctor with specialized training,
Mm-hmm.
there to sort of help them navigate through this, to answer any kind of questions, concerns about medications and symptoms. So.
Okay, our first break is here. Correct, Brad?
Yep.
It's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
Oh, that went fast.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at midshoprx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Hi, Paul White here for the Half Off and Out by Store in Louisville. In honor of Memorial Day, 20% off sale is going on now. We have gas grills and charcoal grills and grilling accessories, tents, air mattresses, coolers, children's swimming pools, pool toys, and so much more to make your weekend great. So stop in and take advantage of the 20% off our already low prices at the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at midshoprx.com.
All right. If a person's already gone through group therapy or an IOP before, could they benefit from participating again?
Yeah, actually, it doesn't happen that often with ours, but it does happen sometimes. Mm-hmm. Sometimes there's been a period of time since the last time they went through a program. Sometimes a person's situation out, at home has changed, and they've got a lot of acute or chronic stressors, and some of those can be physical stressors, pain, things that our spouses or significant others or children go through that is causing us as a caregiver to really struggle. So it's not a reflection on the fact that they failed, by coming back. It's a reflection of their life has changed. And we do have to talk to them about that too, because a lot of people will think, oh, I failed because I have to come back in, which is actually not how we look at it. They don't have to come back in. They are catching their symptoms quicker than they did the last time. And so sometimes we'll just say, oh, you're just coming in for a tune-up. And they'll go, yeah. So it can always be beneficial. But sometimes when people call in and say, I think I need to come back, we can talk to them on the phone and sort of figure out sometimes, hey, maybe you just need to get back to your individual counselor. Yeah. or maybe when was the last time you saw your psychiatrist or nurse practitioner. So it may not be that they need to come back, but it's an option.
Okay. What modalities or therapies in your program do you base your practice on?
So we have quite a few. Primary would probably be cognitive behavioral therapy, or CBT. This is an evidence-based therapy, and it's what most of our skills in our program are based off of. We also have dialectical behavior therapy, or DBT. Some of those skills are intermingled with the CBT ones. We have acceptance and commitment therapy as well as expressive art therapy, as well as brief solution-focused therapy. So we have a wide range of ways that we help or at least provide opportunities for patients to grasp different concepts and skills, because not everybody learns in the same way, not everybody connects to the skills on the same level. So having many different options for support and ways to learn how to manage and maneuver through life is a great option to have.
The problem, or the thing that somebody struggles with a lot when they first come in is accepting where their life is at this point and what they're struggling with, and then how do I adapt to that?
Yeah.
So that's we have a lot of, like Molly said, a lot of different ways we can help them through that.
Interesting.
So can you give some examples of how a patient or a person might benefit from participating in the intensive outpatient program?
Yeah. So one of the tertiary benefits is it helps a person get back their functioning. Because a lot of times when someone is coming into the program, before they come in, there's a lot of social isolation, lack of motivation. A lot of people are they're missing school, as Molly mentioned earlier, missing work, or if they're at work, concentration and focus is poor. So a lot of times people are at home, in bed. They might roll from the bed to the couch sometimes, but there's that functioning, and they come in every day, which is not easy, but they do. And it gets them back into life. And then again, as Molly mentioned, we have a lot of skills that we teach. And these are very applicable skills that help us navigate through life again, get somebody's confidence back.
So if a person has already done group therapy or intensive outpatient program before, could they benefit from participating again?
So, as Renee mentioned earlier, they would benefit. And sometimes when they call in and they're not sure, we'll go with them over the phone over what's going on recently. Does it warrant coming in again? Sometimes they think they need IOP again, or they might need another referral to perhaps a different similar support. So if it's group therapy or if it's DBT, because we also have access to other referral sources and groups such as DBT, that they may not need IOP intensively again every day, but DBT is, for example, a once a week group. So we have the opportunity to discuss with them what would best meet their needs. And sometimes it is IOP again, and they can benefit from it. But that also means, and Renee, I don't know if mentioned earlier, but even when they come in for that tune-up, if they would repeat our program or another IOP, it's typically not as long sometimes that they're with us. As Renee mentioned earlier, the average time somebody's usually in IOP is about 12 to 13 days. But if somebody comes back to the program after already doing it before, we sometimes find them not here as long as that 12 to 13 days. Sometimes they're here maybe 7 to 8, or maybe a range in between. That average length of time shifts a little bit because they may only need that tune-up, or once they do a couple of days, they realize they're actually catching it, like Renee said, a lot faster than they had been before. So they're able to bounce back a lot sooner, which is really helpful.
We do have something called pathways too. So even though we only have them in the IOP program for about 12, 13 days, we have something called pathways, and that's a follow-up group. And so anyone who completes the program, graduates, as we say, we set them up for these follow-up groups, also facilitated by us. Part of the program is like a step down.
Mm-hmm.
And that is once a week for 90 minutes. So we don't just go from every day to nothing. It's once a week, 90 minutes. And it usually, we have them spaced out over 2 months, which helps somebody continue using those skills, check in on themselves and with us, and help support that knowledge that they garnered while they were in here.
So, what are the services in your program?
So earlier, Renee mentioned that there is a psychiatrist. So that is that medical professional, specially trained, that would see them while they're engaged in the program, as well as they would receive group therapy, which is what the IOP program is predominantly based off of, is group therapy. However, they also would receive individual counseling while they're with us. So they would meet with us for a few individual sessions throughout their time, but they can always request more individual sessions as well as time progresses if they feel the need for it. Now, in addition to that, we also offer sometimes family support sessions. So we have family members of patients who sometimes call in with questions, concerns, and are also in need of additional supports that we can offer to them as well. So we've had family members come in where we sit down either with them individually as the family member, or sometimes as a family session with the patient included as well, to just offer our support, empathy, compassion, with reflective listening most of the time, just to kind of see, hey, how can we help meet the needs of all involved? Because typically when somebody's coming to IOP, whether they're prompted by a medical professional or by family members, oftentimes our support systems desperately want to help. They just don't know how. And so anytime that we can offer support to not just the patient, but their family, is greatly beneficial.
I guess I'm thinking that there would be a few people, or maybe even many people, in a group therapy that are afraid to say anything, or shy, or how do you draw that out?
Okay. So the first time we meet with them, it's a lot of, it's called our intake or assessment. It's a lot of information gathering, stressors and symptoms and things that are bothering them. We don't talk about those real intimate details within group and in front of people. It's just not necessary. And I think that's a misnomer when it comes to group. We don't, we're not all sitting around and sharing our deep, dark secrets. That's left for when we meet with a person individually. And what I always tell somebody, when I'm doing their intake, is just come in tomorrow on your first day. Don't worry about talking or saying anything. Just sort of watch how it's done. The concepts and the skills that we talk about, they're applying those things to those problems in their, in their head, the ones that we've already talked about with them. And when they do talk in group, we facilitate in such a way that we don't ask for details. It's important for them to be comfortable while they're in group. And in fact, there will be some times where people, may start to overshare, and, we'll just gently redirect them and say, hey, you don't have to go into details. And, but that's a symptom too, just like somebody's fearful of talking and sharing, which is just fine. And, it makes sense. A symptom can also be, I've got poor boundaries and don't know when to stop and what's appropriate and what isn't. And so we help them with that.
One of the biggest pieces for that is when we stress also the importance that we never force anybody to share anything they're not wanting to share within the group. We provide opportunity for them to give input and feedback, but nobody's ever forced to share within the group. I've had people in my groups, I know Renee has had people in her groups that have sat most of the time and just listened and didn't share hardly anything for the first couple days, and that's okay. We just provide opportunity, but we never force anybody to share within the group whatever they're not comfortable with.
Okay, folks. It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple. Easy way to save money at your local Medicine Center Pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Hi, Paul White here for the Half Off and Out by Store in Louisville. In honor of Memorial Day, 20% off sale is going on now. We have gas grills and charcoal grills and grilling accessories, tents, air mattresses, coolers, children's swimming pools, pool toys, and so much more to make your weekend great. So stop in and take advantage of the 20% off our already low prices at the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, Memorial Day parades and other festivities are being held across Stark County on Monday and throughout the weekend as well. City of Canton is no exception. The parade will begin at 10 a.m. at the Timken Career Campus along McKinley Avenue Northwest, and the route runs to the McKinley Monument. The parade grand marshal and honorary speaker will be U.S. Army retired Major General Dan Hahn. A memorial program honoring deceased veterans and Gold Star families will be held at 11:30 on Monday morning at the McKinley Memorial, and country music artist Ricky Lee will perform at noon. Trump administration has stopped Harvard University from enrolling international students, affecting nearly 6,800 current foreign students who must now transfer to other schools or lose their legal status in the U.S. Homeland Security Secretary Kristi Noem sent a letter to Harvard saying the decision was made because the university did not provide requested records about foreign students involved in misconduct. With the unofficial kickoff of summer here, experts at NerdWallet say travel prices are actually cheaper this year compared to Memorial Day last year. The overall cost of travel is down 2%. Airfare is down nearly 8%. In sports, the Guardians beat the first-place Tigers 7-0 last night. They'll play again tonight, 7:10 first pitch, here on WHBC. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
AccuWeather forecast for today, partly sunny, breezy. You'll see a passing shower or two with a high 53. For tonight, mainly cloudy and chilly, low 43. For tomorrow, a shower in spots, otherwise sunshine and clouds, the high for Saturday 58, low 42 for tomorrow night. Sunday, mainly cloudy, cool with a high 62, Monday's high 65. I'm Andy Robb for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. With us this morning, we are talking to Renee Meyer and Molly France from Aultman Hospital. So, what symptoms or diagnosis can be helped?
Okay. For those coming in the program, quite prevalent for someone to be struggling with a pretty severe depression and or anxiety. But we've had diagnoses such as bipolar disorder, borderline personality disorder. Um, there's a plethora of diagnoses,
PTSD.
personality disorders, PTSD, trauma, a lot of trauma, people struggling with it when they come in here. And the diagnoses matter to a certain extent, but really we target the symptoms, and there's a lot of overlapping symptoms within those numerous diagnoses. For example, concentration and focus, anxiety, energy levels, sleep, motivation, suicide ideation is a big one that people struggle with when they come in here. So again, those we learn about the symptoms when they come in for that first intake, and the symptoms are what we target with the concepts that we teach, and then the skills that we teach people. So.
What kind of age range for your group do you help support in the intensive outpatient program?
Typically, we have a wide range, but the minimum is 18 years and older. But what we have found is that when we have a group dynamic, is what we reference, the group as a whole, when we have a variety of ages in there, as young as 18, I think our eldest was 92, 93 in the program. So there is never a time where change isn't possible. So age is no limit when it comes to wanting to feel better. And so when coming to our program, we request at least 18 years and older, but we've had usually a wide range in between.
That makes it sort of cool too, because having different generations in here. So if a young person is coming in and they're struggling with relationships with parents, here is a parent now who is probably, and they're also struggling with their relationship with the child. And so the group dynamics and hearing perspective from other people is really helpful for folks coming in.
Go ahead.
How many of the patients are these individuals come in with one of their relatives or mother, father, or is that a high percentage?
So typically, when somebody is being referred to the program, the patient themselves participates first. And if a family member would benefit, or if they're interested in also participating, they would come after that individual has completed. They can never complete the program at the same time. So what we typically do is allow them to ask questions, and again, come in as more of a supportive role in one of those family sessions I mentioned earlier. But we have seen many, many times where parents and children, siblings, relatives will come back to back. After one completes the program, we slide the next family member in, and we've done that before. And there's been a great benefit to that, actually, because there's a wide connection there of the skills, and also a better understanding of perspective of the other person.
We do get family members that come in with the patient on their intake day. Well, we got a call from a parent this morning, and concerned about their daughter. And so we're going to be on the phone with them later, both of them. And more than likely that mom will come in with that child. The child's, above 18, but family members will come in. Spouses come in with their significant other that they would like to have in the program. Moms come in with their older children. Sometimes older children come in with the parents. Sometimes if the parent is the one that's being referred here. So yeah, getting back to that question, it's pretty common for somebody to have somebody come in and sit in that intake with them for support.
What's the size of your groups? Do you have a maximum size?
Yeah. So therapeutically, you want to try and keep it around 7. When we have more in the program, we split them, and that way, you don't want to have more than 7. Sometimes, depending on what we're doing that day, we'll have everyone together with a higher number, like maybe 8 or 9. But stereotypically, it's a good idea therapeutically to keep it around 7, 8 at the most, unless you've got 2 counselors in there. So,
Okay.
Okay, you mentioned counselors. How often does a person in the group meet individually with a counselor throughout their time in the program?
So typically, we have at least 3 predetermined sessions that they will meet individually. The first one, as Renee mentioned earlier, is considered the intake appointment. So this is that initial assessment where we meet one-on-one, a lot of information gathering. And then right around halfway through the program, which we say is about day 5, 6, we meet again for what we call the treatment plan update, or where we check in with the patient, go over symptoms, progress, change, how they feel about the program, if they find it helpful. These are important questions that we ask them at this next individual session. But we also allow them opportunity throughout their time, not just at this individual session, to talk about maybe some things that have come up in their personal life that they just weren't comfortable talking about in group. And so this is an opportunity to have that one-on-one session and apply what they've been learning in the groups to what is personally happening at home. And so there's that a cross connection there with the skills that they're learning and how we kind of guide them to figuring out what skills would best help with their personal situation happening at home. And then typically the last individual session we have is a relatively a brief one, but it's where we meet with them when they graduate the program, or where we talk about their follow-up appointments when they discharge, which is typically with their individual counselor, if they have one already, or we help coordinate one for them with their psychiatrist or their nurse practitioner, as well as referrals, for example, like Pathways, which is what Renee mentioned earlier, is our step-down aftercare program of IOP. So we sit down with them and go over these, as well as any questions that they may have about kind of what happens after IOP.
I'm kind of wondering, I'm thinking about your group concept and your setting, and you've talked about different age ranges, and I think that's really interesting. I'm sure that the conversations can get quite personal, but I'm also thinking that maybe, people don't have to probably bare their soul. How does a group session dynamic work when it comes to personal struggles?
So, for example, we'll teach a skill that day. We have, and we don't have a predetermined module that we teach on Wednesday, that we teach on Thursday. It really is contingent on what a group as a whole, what we're feeling and what's being needed. But what was the question again?
The group dynamic, like sharing personal information.
Oh yeah, sorry about that. And so we do a lot of the facilitating. We do a lot of facilitating, but we do a lot of guiding too.
Yeah.
The questions that are prompts, the questions that we ask, will sort of allow folks to know what their answer would be. And we'll always usually start with a vet, like a person that's been in the program for a while and gets it. And they can sort of, and then everyone else, the newer folks, can sort of see how it's done. And we will, if somebody starts sharing a little bit too much, because there are some really sensitive topics that, you have to be careful with. Again, trauma-based kind of information. And so you as a facilitator have to be able to gently redirect from that, because it is tricky and it is personal, and it can be tough for somebody else to hear things that they don't really need to hear.
Mm-hmm. Okay. You're listening to Health Matters with the Medicine Center Pharmacy. It's time for our final break.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local medicine center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy. Hi, Paul White here for the Half Off on Out By store in Louisville. In honor of Memorial Day, 20% off sale is going on now. We have gas grills and charcoal grills and grilling accessories, tents, air mattresses, coolers, children's swimming pools, pool toys, and so much more to make your weekend great. So stop in and take advantage of the 20% off our already low prices at the Half Off on Out By store in Louisville next to the Medicine Center Pharmacy. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay, welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show. I kind of have a feel for your organization that isn't this organization sort of like an alcoholism situation, and how many do these people cross over from alcoholism, or are some of them in the group?
Yeah, so we are not a chemical dependency based IOP. We're mental health based, but substance use is a symptom. We consider it as a symptom of mental health. And sometimes it's actually quite prevalent for someone to come in for mental health reasons, but also have a substance use habit, or it's starting to disrupt their lives. And so it is prevalent in here. Now, when we talk to somebody in the beginning at that assessment, we'll also determine, do they need us first, or depending on the substance and the severity of it, or do they need a chemical dependency IOP first, or inpatient
Or
detox. So we'll find out that information, but it is quite prevalent. And what we do is we consider it a symptom, another behavior. We talked about emotions, thoughts, and behaviors being symptoms. And so we'll talk to them about that substance use as if because it is another habit. And we'll ask them, what would you like to see happen with that?
Yeah.
Because it's not up to us to tell them what to do with it. They're independent adults coming in, and the biggest thing we want to do is empower somebody and make sure that they understand that these are their goals. This is their life that they want to cultivate. So, but it is prevalent.
We may have touched about this before, but how involved are family members in the care while in the program?
So family members can be involved as much as not just the patient wants, but we've also had family members call in to just share concerns that they may have had while patients are participating in the program. But typically what we do is the patient coming into the program is, yes, our priority, and somebody that we have our focus on, but the family support system is just as important to offer supports to. And so sometimes family members, as Renee mentioned, will come in for the intake, or will ask, hey, can you meet with me? I have some concerns. Can we talk on the phone? Other times patients will come to us and say, I have some concerns. I'm having some difficulty with this relationship in my life, whether it's a family member, a friend, a significant other, a spouse. Is there an opportunity? Can we sit down, all of us together? And so we've had many different avenues we've explored with family members and support systems, but typically family involvement, we offer as much support and encouragement as we can, with the patient in mind as primary, in terms of not for focus, and making sure that how to best meet their needs takes precedence.
You wouldn't want large quantities of family members coming in at the same time, would you?
Not typically. We usually have a one person support system will come in. Very rarely have we had, maybe, for example, two parents come in with their child if the child is going to be participating. Sometimes we've had a spouse and maybe a family friend come in before, or another relative. But very rarely do we have large groups of families come in for a session. Typically what we do is, if they have multiple family members with concerns, we'll address those concerns more individually with each family member on a separate occasion.
So what happens after a person completes Aultman Hospital's intensive outpatient program?
So we have a follow-up group, which is Pathways, and that's only for those who complete the IOP program. And when they do come to Pathways, which, as I mentioned earlier, it's one time a week, at least the first 4 weeks, for an hour and a half, that is done at the same time they're returning to their individual therapist, and at the same time that they are still seeing their psychiatrist or psychiatric nurse practitioner. And so when they leave here, they've got services coordinated going on at the same time that they probably didn't have before they came in. And usually all of these people are aware of each other and what the patient is working on. When the patient leaves IOP, for instance, I just talked to somebody yesterday. What do I talk about with my counselor when I go back? And so what I'll say is, hey, take your skill sheet in there and say, this is the behavior skill, this is the thought skill I've been using the most. and then just tell them how you've been using it. And it's a nice sort of segue back into your individual counselor, or if you're starting with a new one, because it's really hard to tell them everything. So just helping them, find their way back to their individual counselor or a new person is important.
What about some semantics like insurance coverage for your program?
Right. So anytime somebody is wanting to get started in the IOP program, we do a courtesy benefits check with their insurance. So that way it's one less stressor for the patient to worry about. We alleviate that portion at least prior to them coming in. We'll call and make sure that our specific program is in network with their plan. We get details like deductible and coverage and things like that. And we go over all this information prior to them attending the intake. And this piece is always very, very helpful, but also it's a bit of a relief for some patients as well, because when you're coming to IOP and a lot of the stressors of life are laying on somebody, financial strain is one of the biggest ones most oftentimes. And so being able to alleviate some of that stress is really helpful.
Mm-hmm. The other piece that goes along with that is it's quite prevalent for somebody coming into the program to be off of work on FMLA, that Family Medical Leave Act, and also short-term disability is prevalent too. And because most people, their symptoms have gotten to the point where they're not able to work. Some people still work while they're in here.
Yeah.
But they bring on their intake, they let us know, and on their first day of the program, they bring in their paperwork from HR that's for FMLA and for short-term disability, and we walk them through that, and we do our part too, because that's pretty stressful for them. Most people have not been off on FMLA or short-term disability, and it's one more stressor and piece of responsibility that is stressing them out. So we walk them through that. Most of the time, they don't have to do anything. It's all on our part.
All right, we're running a little close on time, and I want to make sure that listeners can get some of the most important info out of you ladies about your program. So a couple things, if you could summarize, what should a person do if they want to get started with your intensive outpatient program, and do they need a referral, and how soon can someone get involved?
No referral needed. The phone number is 330-451-2070. That's the phone number. Providers can also do referrals by fax or phone call. The fax is 330-451-2077. And they just call, and we sit down with them on the phone and tell them about the program and answer any kind of questions they may have. The first step is that, and then to set a date for an intake. We can get them in usually right away. There's not a wait period because, let's face it, people have been feeling not the best for a while. And usually when they come in for that intake, we usually get them started the very next day. So the wait is minimal.
What's the maximum amount of time that an individual would spend in this group arrangement?
So the intake is about an hour and a half. That's the first day that they come in for that one-on-one. And then whenever they start the program, we would like to start them the very next day. But whatever their first day is, they would average about 12 to 13 days in the program. But again, that's the average length of time. Sometimes depending on life circumstance, work, symptoms, some people are here a little less, some people are here a little more. So we work with them and make sure that if they need longer time, then by all means, they stay longer. If they have to leave earlier, then we make sure they're set up for success with their post follow-up care.
I'm thinking we're out of time, right, Brad?
Yeah. Do you ladies have anything you want to leave as a takeaway before we wrap up?
No, other than if you need help, don't hesitate to call. We're only a phone call away. Even if you have questions and you're just not sure if IOP is what you need. We've had many people call and ask, and we say, you know what, I don't know that you may need us, but here's who we can refer you to. So it doesn't hurt to call.
Wonderful.
Wow. Okay. Thank you to our guests today, Renee Meyer, LPCC, and Molly France, LPC, from Aultman Hospital Health Intensive Outpatient Program. If you suspect you have a medical issue, please contact our healthcare provider. Thanks to Aultman Health System and their listeners for joining us on Health Matters with the Medicine Center Pharmacy. If you have a healthy week, we hope, and we'll see you again next Friday right here on News Talk 1480 WH.